Have you watched my 2 previous videos on the use of Botox and fillers? If you haven't, I would suggest that you watch them first and then watch this video, because this is a follow-up of those 2 previous videos. I'm sure many of you have had questions about what are the indications of Botox and what are the indications of fillers and where would we want to use all of them. So now I'm going to do a face analysis. This face which I'm going to put up has almost all the features that one would ideally look at in the use of Botox and fillers. And if you're interested in this, do watch ahead. You're going to have a lovely time. My name is Dr. Amit. I'm a plastic surgeon with an 11-year experience in the field of plastic and aesthetic surgery. So let's start assessing this face. So this is a middle-aged guy and it's a very typical face to understand how we approach someone and advise on the use of fillers and Botoxes. Now if we see from the top, you can see very heavy wrinkle lines on the forehead. These are dynamic lines. So like in my first video I had said, we treat dynamic lines with Botox. So we would Botox the forehead all along here and take care of all these lines, and there would be a dramatic improvement in the forehead appearance. As soon as we take off the lines, the facial age just comes down by about 5 years. It's a very, very dramatic appearance by the use of botulinum toxin. Also, when we inject Botox on the top part of the forehead, somewhere here, we find a lengthening of the forehead. So you can actually lengthen your forehead a bit by the use of botulinum toxin. If you want to know why, just WhatsApp me on 9999972949. I'll let you know the reason why that happens. At this stage, it's beyond the scope of this discussion. We also see, if I would have asked, if you see carefully, there are also some lines all along the outer side of the eye. If I ask this gentleman to smile, he will probably have a lot of wrinkles along the eyes, and if I ask him to frown, he may have a lot of wrinkles along the upper part of the eyebrow as well. So all that part is Botoxed, and that tends to erase those lines of being anxious or angry or curious. So that's essential. So another thing that is important is when we are tackling a face with Botox and fillers, we are trying to change expressions. A person looking upset, angry, anxious can be converted to a person looking happy, younger, slimmer, just by the use of these products. The old concepts of just overdoing Botox and removing all the lines or filling the face has gone away. Now it's about creating more natural looks. We want to have natural lines of expression. We want to have a situation where when we express, these lines get visible. So we don't want to erase them out completely. So let's go down. Now I said that if there's a shadow developing, that area needs fillers. So look at the under eyes. If you see the under eye segment, there's a lot of shadow developing here. That means there's loss of volume and we need to fill this. If we fill this with fillers, there's going to be a dramatic change in his appearance. So also if you see, there's a lot of cheek hollowing. If you see this segment, note on the other side, it's really hollow in this part of the cheek. That is because the cheek has descended down. So we need to fill here at this point where the arrow is, and that tends to lift up the cheek and restore a lot of his youth. His cheeks on the lateral side are also extremely hollow, literally is just bony. So we need to do something there as well in terms of fillers. Just fill a little bit here. That tends to cause a nice gentle lift and improve the overall mid-face look. Then if you see, there are laughter lines. Laughter lines are the lines along the nose and the mouth. So these are laughter lines which again we fill with the use of fillers. Now he's a man, but if you see, his upper lip is really small. So if this lip was there in a woman, I would have suggested lip filler, lip enlargement as well. Men generally don't do lip fillers. If someone has a deviated nose or a nose which is not sharp or little depressed, we can do fillers to improve the nose shape as well. Someone has a chin which is very sort of stubby and not really pointed, not sharp, we can improve the facial appearances of the chin as well.